Good morning, everyone. I'm Emily Akhtarzandi, Managing Director of AtlanticLIVE, and I'm delighted to welcome you to our event this morning, The Equity of Health. Today, we'll examine what can be done to expand access and reduce costs throughout the healthcare system. We need no reminder that the U.S. spends more on healthcare than any other country, and yet we are far from the healthiest country. Too much is spent on the sickest and most complicated medical cases, and yet for many Americans, access to care is lacking. The Atlantic recently explored this issue in our pages with an in-depth look at health equity in Baltimore, where we explored how the community is looking for solutions from housing to food to healthcare. And so today, we'll continue to explore how all stakeholders can work to expand access, reduce cost, and increase outcomes. Before we begin, I'd like to take a moment to thank our underwriter, UnitedHealthcare, for making this conversation possible. And a few housekeeping notes. Please silence your cell phones, but keep them out to follow the conversation on Twitter. Our handle is @AtlanticLIVE, and we're using the hashtag AtlanticHealthEquity. And we'll have time to take your questions here in the room throughout the morning after the panels. So first up, for a conversation about the government's role in health equity, please welcome to the stage Seema Verma, the administrator of the Centers for Medicare and Medicaid Services. And here to lead the conversation, please welcome the Atlantic's Washington editor-at-large, Steve Clemens.